Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today's topic is SCD, prevention of early death. SCD simply means sickle cell disease. But you don't develop sickle cell disease from the womb. What you develop and what you see is that the baby are born, all babies are born healthy, and you now want to believe that that child has no problem. We all pray that no child will have any problem. But that child has been born with inborn errors that will continue to show itself as the child continues to lose the hemoglobin, the fetal hemoglobin. The fetal hemoglobin is replaced by adult hemoglobin as the child grows old, and that is where you start seeing the sickle cell disease. So some children start showing this sickle cell disease by age 1, but many still have the fetal hemoglobin that covers it. So how do we help these children? That is my basic concern. What treatment can also be given will also be exposed, but you need to follow me on my slide session. As usual, if you like my presentation, press the like button, subscribe, and more information will come your way. The outline: objective, introduction, WHO and regional effort at prevention, lab diagnosis, treatment, and the future of this SCD. The objective: to educate the people on why babies don't experience SCD at birth, how to identify children that will develop it, and how to prevent early deaths and also reduce the prevalence of SCD with medical laboratory investigations. Introduction. Sickle cell disease is a genetic disorder caused by mutation in the beta globulin chain of hemoglobin, as shown in the diagram above, leading to abnormal red blood cells, severe pains, anemia, organ damage, and increased infection risk. Inherited in an autosomal recessive manner, it mainly affects regions with high malaria incidence like sub-Saharan Africa, the Middle East, and the Indian subcontinent. Some African Americans do experience it though. The fetus, baby in the womb, does not have the mutated beta globulin chain of hemoglobin, but they have the gamma globulin chain of hemoglobin that doesn't polymerize. That is, it doesn't clump together and block the flow of blood, creating those painful crises experienced by sickle cell disease children. The prevalence of SCD is controlled in developed countries, but the developing countries have so many issues to contend with. Against a backdrop of a huge infrastructural deficit, the mortality from SCD, even the morbidity, particularly in under 5, remains unacceptably high. Recent estimates have shown that without timely and adequate intervention, up to 90% of affected children will die before the age of 5 from organ system dysfunction, including mainly renal, cardiovascular, and cerebrovascular. The problems occur earlier at highly frequency, contributing to early deaths. Is that early death that is the emphasis? Saudi Arabia was able to do something remarkable as a significant burden they have of SCD and thalassemia. The prevalence rate of 4.2%, 0.26%, and 3.22% were reported for hemoglobin AS, SCD, and beta thalassemia, respectively, in 2007. In a bid to reduce the huge burden on healthcare as well as the negative impact on the quality of life of patients, premarital genetic screening for hemoglobinopathies was made mandatory in the country since the year 2004, and they reduced it from 32.9% to 9%. Now to the various efforts at prevention. The WHO adopted the strategies of early detection, that is newborn screening carriers, that is using the placenta and the amniotic fluid to diagnose chromosomal problems, genetic disorder, and genetic counseling, where you now look for carriers, that is, people who are AS to AS, premarital counseling. WHO also emphasizes the importance of comprehensive care for individuals with SCD, especially during pregnancy, and addressing the stigma and discrimination. Yeah, effort by various countries could be seen. Nigeria, for example, Nigeria's National Sickle Cell Disease Control Program was set up and has made strides in improving management and outcome through newborn screening, public education, and enhanced healthcare access. India has the second highest prevalence and has been made progress in a few centers in India. Many patients in remote areas still lack adequate management due to limited resources and access to hospital. Then let's talk about Middle East. In Saudi Arabia and other Middle East countries, premarital genetic counseling and screening have significantly reduced the prevalence of SCD and beta thalassemia. The Prime Minister of India on 1st July 2023 in Pradesh launched the National Sickle Cell Anemia Elimination Mission. It is an ambitious healthcare initiative aimed at eradicating sickle cell disease through comprehensive screening, early diagnosis, and advanced treatment protocol. You can see from all this that all these countries are making effort, but resource still means a serious holdback. It really is making life difficult for the citizen in rural. Outside the effort of the various countries within these zones where sickle cell is endemic because of the genetic mutation against malaria, especially. We can also talk about the prevention effort of those who are suffering from sickle cell disease, what they can do to help themselves, to help prevent and reduce the occurrence of pain crisis. What we can do includes drink plenty of water, try not to get too hot or too cold, try to avoid places or situations that cause exposure to high altitude, and try to avoid places or situations with exposure to low oxygen level. Oxygen causes this crisis. That is, once there is lack of oxygen, already you are under stress, and that means the sickle cell will now be under crisis and clump together. Yeah, now lab diagnosis. The laboratory is very useful to really confirm that a person is a sickler. There are so many tests that could be done because, like I earlier said, you may not know you are a sickler until when these sicknesses keeps coming and coming, and the blood test now needs to be done. So the blood tests done are CBC, hemoglobin estimation, PCV, hemoglobin electrophoresis solubility tests, blood smear film reading, genetic testing, prenatal testing, all and many more that could be done. Yeah, like it is common with all chronic diseases, treatment is about management, which includes blood transfusion, hydroxyurea, folic acid, iron chelators, as shown in the diagram above. The treatment is usually symptomatic, that is, you treat the symptoms. When there is a lack of enough blood, not necessarily very anemic, the folic acid, the film readings could show megaloblastic anemia, and the folic acid will be very useful. There may be a need for blood transfusion when the person is very anemic, and other factors like that. Other effort being made is this oxybrita, which holds the hemoglobin in a particular shape that prevents sickle cell from stacking, preventing the complication like organ damage and pains, which are usually due to the
organs not receiving oxygen. When the organs don't receive oxygen, they die, and that's why it affects all the organs of this and the systems. And the nutrient is also blocked that way. And this work is from Kim Smith, Whitley, and the head of research. Yeah, now let's talk about the future. The future is about cure. When we are talking of no more sickle cell disease, using hematopoietic stem cells transplantation, HSCT, or call it gene therapy. One of the curative options, but limited by donor compatibility. Ossibrita that I just spoke about is another option. Research from the New England Journal of Medicine suggests that gene therapy like globulin could offer a potential cure for SCD. Children and adults with sickle cell disease who are 12 and older are eligible to receive the new gene-based treatment, Casgevy or Lyfgenia. With bone marrow transplantation success, SCD eradication becomes a promising achievement. So we can look with happiness and joy that SCD may eventually be a thing of the past. So, but malaria is still endemic, and that is one of the reasons of the mutation for survival, the evolution that took place many centuries ago may be, I don't know whether reverse or probably something else could happen, because the gene themselves can take the next step to survive this malaria onslaught. If we cannot overcome malaria, we may be having another kind of experience. So if you like my slides, please always subscribe.